Meeting will please come to order, and could I get Councilor Kukowski to say the lead us in blessing today?
Dear gracious and heavenly Father, we thank you for this time to come together and to do the work for our Cherokee citizens. And Father, we just ask for your guidance and direction. Father, I just pray for every single person in the world, whatever they're facing today, Father, I just pray that you would be with them. For it's in Jesus' name we pray. Amen.
Amen. Roll call vote. Yes, ma'am. Mary Baker Shaw. Aye. Mike Dobbins. Keith Austin.
Here.
Kelly Buzzard.
Here.
Joe Bird.
Aye.
Julia Cook. Tom Hendricks.
Here.
Joe Deere.
Come here, it's on TV.
Hannah Duncan.
Aye.
We need that. Jordan. Hold him.
Here.
Daryl Legg. Wes Notfire.
Aye.
Nora Petskowski. Mike Shinbaugh. Neil Smith.
Here.
Denise Taylor. Here. Victoria Westwood. We have one. Thank you for that. Appreciate it. Has everyone had time to review the minutes?
Yes, I make a motion they be approved.
Second.
Motion made second. All in favor, say aye.
Aye.
Aye. Okay, first report is the Claremore Service Unit. Is Mr. Brewer with us today? I'm not seeing him, so we will go with Cherokee Nation Health Services, Dr. Steve Jones, and I see him up there. Does everybody have access to the TVs? Harley, Councilor Buzzard, can you see this TV? I'm curious, do we still need to pull the screen down for everybody to have visibility? I think
Yeah.
so.
It's hard from this angle.
I think if it's straight, that I can see it all right.
Yeah, it's angled.
It's gonna make it very hard on that end, so if the screen was down, that'd be.
I'm just gonna sit in the middle, and I can see.
But I don't think you see it, I haven't painted for 2 years anyway.
You are a lifesaver.
I try, sir, I try. Okay, well, we will go on with Dr. Steve Jones. Good morning, Dr. Jones, and happy holidays.
Good afternoon. Can you guys hear me okay?
Yes.
Loud and clear.
Okay. All right. So I know there's a lot of questions. I've received a lot of questions through text and email the last few days on our vaccine, but I'll get to our written report first, and then we can go to those questions if that's okay with you guys. So the first thing, as I said, our written report's been submitted. I won't go into very much detail. I do want to call into your attention the fact that we got our acute stroke readiness accreditation. That's a very big accomplishment. I mentioned it last time. It made its way on the report this time. So our employees, in the midst of all the other things they're doing, are working through these accreditations, and still there's a lot of things besides COVID that we do, and this is acknowledgement to them for all their hard work to be able to get us to this point on this accreditation. So just want to acknowledge that. And then as we move through the report, a lot of things in there, the same things we had before. If there's any questions for any of those items that are in the report, I'd be glad to answer those. I do want to call attention to the last page on the testing. There's a breakdown by clinic as of when this report was submitted, which is always behind where we currently are. So I want to go ahead and give you an update. We're at 62,628 tests as of Friday, with 7,719 tests positive. So,
Dr. Jones, let me interrupt you just for a second until we're through here. We're trying to get a screen down for the visibility of everyone in the room. You'll wait just a second. It's coming.
Sure.
Thank you.
Okay, I think we can go ahead and start. We're going to get this, yeah, he's going to get it going. Okay, thank you, Dr. Jones.
All right. And so I know that there was, I've watched social media too, and some of the questions that come out, and there were a lot of questions around our positivity rate and how many people were recovered versus still fighting that battle. That's a hard number to quantify. We try to put some numbers to it, and so that we can kind of give a round figure of how many people are still fighting the virus, that are actively fighting it currently, and those are not by any means a accurate number, but it's just an estimation based on our anecdotal information that we have, and that's around 1,800 patients currently within our health system that we know about that are fighting that virus currently. So just that's not an easy number to grab hold of. So I just wanted to acknowledge that just a little bit. If there's any other questions about the report specifically, I'll answer those now before I move into information on the vaccine, if you would like.
Anybody have any questions so far for Dr. Jones before he talks about the vaccine? Go ahead, Dr. Jones. Thank you.
Okay, so first thing I want to talk about a little bit is we have a couple of medicaments that we're using to treat those patients that are diagnosed with COVID. Obviously, remdesivir is something that you've heard about on the news, and we have talked about that before, that we have that medication available to our patients. Currently, it's a stay in the hospital to receive it. You have to qualify in certain conditions and certain modalities that you, or morbidities that you would have, that qualify you to receive that medication. And it's an infusion of medication in the inpatient setting. We also are involved in a clinical trial with that medication through Gilead that allows us to administer that medication in an outpatient setting. And that study is currently still going forward. The other medication that we've been lucky enough or been given to use for our patients is a monoclonal antibody called bamlanivimab. It's a medication that's administered infusion in an outpatient setting. It takes about 3 hours. We were allocated 500 doses, and we've administered 131 doses as of this morning. And the outcomes on that medication have been really, really good. So that's, again, you have to qualify by certain criteria that in order to receive that medication, but those that have received it, we've seen some very good outcomes. So that's just a little update on some of the things that we're doing to help treat those patients once they have been infected. So now we'll move on to the vaccine. As you know, it's been a lot of press around that this weekend and as of late. As of this morning at 10:30, we received our first allocation of vaccine. I think it's already hit the media earlier that it was 950 doses that we received from the Indian Health Service. They are our jurisdiction, not the state. We did receive some questions on when we would be receiving vaccine from the state and how they would be allocated to us through the state. We are not receiving any vaccine through the state. We had to make a choice on whether we receive the vaccine through the state or through the Indian Health Service. We felt like the lines of communication, the logistics, all those things were much better with IHS than they were through the state. The state seems to be confused in a lot of ways. On one hand, not knowing what the other hand's doing. So we felt like that was the best for us, and as a result, we already received our first allocation. So we felt like we made a good decision there, and we'll continue to work with IHS moving forward. We did offer to be a hub for the state if they wanted us to be able to allocate out to other healthcare systems in our area, since we did have the freezers. But as of this date, we have not had any more communication, and they have not reached out for us to do that. So moving forward, again, we received our first shipment this morning. It was accompanied by the CDC, a representative from the CDC, to witness the transfer of custody from them to us. And that was done and put into our freezer, our ultra-cold freezer this morning about 10:30. And as you know, moving forward, we will start, our goal was to have our first administration of the vaccine within 24 hours when we received it. And we will start administering the vaccine at 7 a.m. tomorrow morning to our healthcare workers that are in the front line for this fight. So our tiered approach, and we put some publication out there already as healthcare frontline workers as our number one first line that will get the vaccine, along with our first responders. And then we will move into our one and only facility that we have as far as residential, and it's not really residential, but elder care facility is also listed on our first tier. And then we'll move on into our other tiers as more allocations become available. And we do not know for sure when those allocations will come and what they will be. We do know we'll be getting 2 more smaller allocations from the Pfizer vaccine in the coming weeks. So let's talk a little bit about the vaccine itself and what we know about it. This first vaccine that has come out is that we have gotten allocation of is from Pfizer. It is FDA approved with emergency use authorization, and I have Dr. Montgomery along with us on this call so that if you have some questions about the vaccine specifically and efficacy and things of that nature, he will be able to answer some of those questions. Since it is an emergency use authorization, it does require a lot of reporting and technical consent and things of that nature. So I want to emphasize, I'll be saying this many times, this is not like a flu vaccine. This is not something that we can just set up and send teams out to start inoculating people. This is not anywhere close to what we have normally seen in a flu vaccine, and I'll explain why in just a few minutes. There are specific requirements with consent. There are specific requirements to report how we and who we've administered the vaccine to, and all that has to be done through the IHS and to Health and Human Services. So our teams, our IT teams, have been working on those communication lines to be able to open up so that we can report it into our electronic health record, and then it can be put into their reporting mechanism. If there's a lot of manual reporting that goes along with that, if that system doesn't hold up, but it has been put together quite quickly on their end. Our teams have been working on it for quite some time. So the Pfizer vaccine must be, and some of these things I'm going to tell you, you obviously have heard news, it must be kept ultra cold, minus 80 degrees Celsius, which is minus 112 degrees Fahrenheit, just to give you some idea how cold it must be kept. The freezer that keeps this vaccine can only be accessed twice a day. So we can only access it twice a day. It takes approximately 2 hours once we access the freezer to pull out enough vaccine to use to get it warmed to room temperature and diluted. Once it's warmed and diluted, then we have 6 hours to use that vaccine or it spoils. So as you can imagine, we can't, our goal in this, one of the things that we set off in the very beginning is we don't waste one single dose. It's very, very sought after, obviously. There's not enough of it to vaccinate everyone that we'd like to vaccinate as quick as we'd like to, so we do not want to waste one single dose. And our team's been working very hard to come up with ways to ensure we don't waste a dose and to make sure we get it into the arms of our people we've identified as quickly as possible and as efficiently as possible. After the injection, the patient must be monitored for 15 minutes for any adverse effects or anything that would happen after the injection. So those patients or employees or the people getting inoculated must be monitored, visually monitored for 15 minutes. Patients must return in 21 days after the injection to receive their booster injection. Then 7 days after that is when you start to see your levels of immunity rise, your titers rise. So it's a very technical vaccine. With a flu shot, we can administer it once and we're done. This one is 21 days after the first injection, you get your second injection. There is no research to show that you have any kind of immunity if you do not receive the second injection. So it's very, very important that we identify who we injected and when that they come back and get that second injection. So we're working very hard to educate everyone on those terms. basically, with all this information, there's a lot of technical things that we have to do in order to ensure that we're successful with this vaccine. So, as a result, a lot of our processes that we're putting in place now, we will learn from, we will change them as we move this out into the next tier and the next tier of participants. But in the beginning, again, it's our frontline healthcare workers. They are employees. We do have the ability to communicate and track them within our own system. So we're going to use this as a learning tool for ourselves in these first exercises. So as we move out to the public, it's going to be a little bit harder to communicate, a little bit harder to track, and we're going to depend on a little bit of patients having taken on their own responsibility on ensuring that they get back in for that second dose. We will be working on ways to identify those next tiers. We're working on ways to communicate and working on ways to ensure that we don't waste a dose by not being able to get that booster. So that's what we know about the Pfizer vaccine. There are other vaccines that are in the pipeline, that are in their clinical trials, and one of the ones you've heard about recently is Moderna. Moderna has a vaccine that's coming out. It's going up for EUA, or Emergency Use Authorization, this week. They will be submitting they will have their panel discussion, and we anticipate that they will probably get approval also. And if they do, then we should be receiving our first shipments from Moderna sometime around Christmas. So the Moderna vaccine, we don't know all the details yet, because there's not a lot of information from the FDA out because it is under review. What we do know is it doesn't require ultra-cold storage. We don't know about how long it takes to prepare it, other than the fact that it's you give the first day and then you wait 28 days to give your second dose, and then you have some type of immunity at day 35. So again, if you can imagine the logistics that it takes from our side to be able to differentiate as these different vaccines come out, and how we can track. If you're a patient that got Pfizer, you get your second dose at 28 days. If you're a patient that got the Moderna vaccine, you don't get your second dose till 28 days. So there's all these different things that we have to track. So as you can imagine, it's a little bit of a logistical challenge. And our team has been working very diligently for quite some time to work out all the details and the processes on how we're going to do this. As it stands right now, we are making our employees an appointment, an allocated time for them to come down because it is so technical, and we don't want to go past that time frame of when we thaw that vaccine out and get it allocated to the individual patient. So as you know, if you can imagine, we can't have no-shows, we can't have delays, there's so many things that could throw us into a situation where we could possibly waste a vaccine. So we're trying to come up with every possible opportunity to make sure that we don't allow that to happen. Other than that, I want to acknowledge that our staff in all of our areas, all of our clinics are working extremely hard right now. We are working through the challenges of having kids out on virtual learning, to having employees out sick, to having employees that are exposed. Our employees are working in the weather. This morning we had our drive-thrus open, and you can imagine how working in this type of weather is for that, to be able to serve our citizens and those that need us right now. So we have a lot of people doing a lot of extra work and a lot of things that are above and beyond, and I just want to acknowledge all the work that they're doing. And if you get a chance to say thank you, if you come to one of our facilities, that's greatly appreciated. I know they will appreciate it. Coming into the holidays is tougher than ever because a lot of people have leave or time that they want to take off, and unfortunately we're entering into a situation where we're needed more than ever. These next few weeks and next month and next 2 months are going to be highly critical to how we come out on the other side of this crisis. So just want to acknowledge all the hard work that they're doing and all the things that they're doing above and beyond at this point in time. So if you have any questions, we'll be glad to try to do our best to answer them for you. We're learning every day too, so on these vaccines, but we'd be glad to try to answer any questions you have.
Thank you, Dr. Jones. Counselor Crittenden, you have a question?
Yeah. Doctor, the third tier you talked about, the elder care, now that was the facilities where they're staying, is that right?
That's the elder care that we have in our, that falls under Cherokee Nation affiliation, which is our Cherokee Elder Care. We are working with them to ensure that we get those folks that are enrolled in our elder care and our employees that take care of those folks vaccinated in this first tier.
If they're at home or if they're in a residential place, both, right?
Well, Cherokee Nation doesn't have any residential elder care currently. So if that's what you're asking, we don't have any nursing homes that we take care of. So that's not.
Yeah. I didn't think
That's
you
your
did.
question. We don't
I
have
didn't think
that.
we did. I thought you mentioned that, but anyhow, so those elders affiliated with our elder care. Now, I've got a few calls like you have and probably everybody here. What's a good answer for our elders that say, how do we get signed up? What's a good answer? I know that you didn't mention that in our tiers other than the elder care folks, but just a good answer for those many calls we're gonna get.
So at this point in time, there will be information coming forward in the future that will tell them exactly how to get signed up and tell them how to reach into our system to get their appointments, get their vaccine. At this time, our allocation is such that we are just going to be able to do our healthcare workers and those and first responders and possibly our elder care program. But we're not ready to move into that next 65 and older tier yet. And as we get closer to it, we'll get more information out on how they can get signed up and how they can reach into our system, or we can get that information out to them on how they can get appointed to do that. Our hope is that when we get to that point and we have more vaccine available to be able to do that, that we'll be able to roll that out to the outlying clinics. And so they're not going to be able to have to come to one location. We'll have several locations that we'll be able to do that on. But at this point in time, we're not ready to move into that tier, and that's why we haven't communicated that. We don't want to cause more confusion than what is already out there. We are trying to reach out to our first language speakers. That is a priority that the chief has asked us to put in priority, and we agree. And so we're in agreement on that, and we have reached out to Mr. Payton, and he is working with us to try to identify and get those folks into getting their vaccination as the allocations become available.
Doc, can we call that
And
the
again,
fourth
we're
tier?
just not quite ready to go there yet, so if you can just communicate that the time will come when we have the allocation to be able to do that, and if we can just hold on, and we will get that information out to you guys, out to our website, out in all the methods of communication that we can possibly do to get that started when that time comes.
Could we call the Cherokee speakers maybe possibly included in the fourth tier?
They're included in the phase one, the first language registry that Mr. Payton keeps.
Okay, well, I meant we got the healthcare providers, frontline, first responders, elder care, and of course, a lot of us have lots of speakers in our districts we represent. So if they're asking if it's a speaker, will they fall, in what you're saying, the fourth, maybe possibly a fourth tier?
We call that Tier 1B, and 1B is going to be a registry that Mr. Payton keeps of Cherokee First Language speakers. So, to my understanding, that's a list that is kept, a registry that is kept, and that's what we're working off of currently.
Okay. Bear with me here while I'm talking to you, Doctor. So if I got a language speaker, I'm not necessarily going to tell them not at this time, or am I?
I would tell them to get with Mr. Payton if they're on the registry that he has, and he will be working through. We're working through him to identify and get those speakers their appointments to get their vaccinations.
Speakers,
So
how?
they're on the registry. So my understanding is that there is a registry that Mr. Payton keeps of all first language speakers, and that is the list that we're working off of.
All right, just one more thing, the healthcare workers, are there any of them that's gonna be mandatory to have the vaccine, or?
This is not a mandatory vaccine. It has an emergency use authorization, therefore it's still under review, and that's part of the reporting is how, and any kind of events or anything that happens to anybody that takes the vaccine. And of course, there has been extensive studies and extensive clinical trials up to now, but the longevity of those clinical trials is not to a point that they could not just give it emergency use authorization. So it is not mandatory. It is absolutely voluntary. We have sent out information to each one of our employees that were identified as frontline first employees that would receive that vaccine. They have been able to share their desire to get the vaccine or not get the vaccine back with us, and as a result, we were able to start appointing them as early as 7 o'clock tomorrow morning. So we're working through that process. We've identified those in our system that fit into those categories, and we're working through that process currently. We weren't able to start that process until we physically received the vaccine. So if we received it today, obviously we start tomorrow. If we were received tomorrow, it would have started Wednesday. So we were on hold until 10:30 this morning until we received the vaccine.
Thank you, doctor. Thank you, ma'am.
Thank you, Councilor Pritchett. Chief of Staff Enlow would like to share some words with us here.
Yeah, so to add a little bit more insight, so elder care has roughly 180 patients in its census, so plus the employees that work there. And while many of those elders still live at home, there are some elders that are affiliated with elder care that actually reside in a nursing home. And so some of the questions you're asking, even though we don't operate any nursing homes or in-house care for elders like that, some of the patients or participants in the PACE program or Cherokee Elder Care actually do reside inside a nursing home. So that would be eligible to those individuals. So it was a little bit of a blend. Even though we don't operate it, yes, we will have some that may be in nursing home care. And the other thing I would like to stress as far as these phases is Dr. Jones very eloquently described the requirements for the care and administration of the vaccine. Not every facility across the United States is actually equipped to handle this vaccine. There are hospitals within our 14 county jurisdiction that will not receive this directly because they don't have the ultra cold storage. We will receive a limited capacity of the Pfizer vaccine, assuming that the FDA approves the Moderna vaccine. Its requirements are a little less, and so we think that we will get more of that. There is another vaccine that is close in tow behind those two, and they're even lesser. And what those do is it opens up the possibility, as Dr. Jones indicated, we can begin to administer that vaccine at a higher rate and don't require as much specialty handling as this first phase. So that phase, those phases that we published may change and may adapt based on the vaccines that we receive and the FDA approval, and it can change and morph. So our first priority is to take care of those that are the greatest risk, that has the most exposure, and then going down in those tiers. So it's my hope that in the future we may revise our vaccination plan based on the changes of requirements as well as the availability of the vaccines. So that it'll be a little bit fluid, but the first tier is absolutely our inpatient healthcare workers that have placed themselves at the greatest risk.
I follow up one.
Oh, real quick, one time.
Thank you. All right, Todd, so this call I got is a speaker. Shall I tell him not at this time or call Howard Payton? Because, you know, some of our districts have lots of speakers. So
Sure.
we can flood you or say not at this time.
I would say not at this time, and here's the reason why is, as Dr. Jones indicated, we thought we were going to get the vaccine today, but realistically we're saying probably this week. because those plans can change on a whim. And so we wanted to make sure that we got that vaccine. There's a slew of employees that we need to address with that first round. And what this does is it builds experience, it builds knowledge. We might identify some things that we may need to change or adapt to make sure. I would encourage them to reach out potentially to Howard. Howard already knows he's gonna help us connect with as many elders as we possibly can, and try and bridge that to make sure. And so as council members, when we get ready to roll that out and really try to ask our speakers to come in, we may ask you guys to help Howard and coordinate with Howard to try and get as many of those speakers that are willing to take the vaccine as. And as you asked earlier, it is not mandatory, but we are encouraging as many people to take it as possible. And so we're looking at some possible incentives for our employees to consider taking the vaccine. But at the same time, we understand that there may be some concerns or reservations, and we want to make sure we try to address those and make sure everybody feels comfortable with it as well.
Okay. Counselor Vasquez.
Yes, I was taking notes, Dr. Jones, whenever you were talking about the Pfizer vaccine, and I didn't get this written down, but when you talked about the patient receiving it must be observed for 15 minutes, and then 21 days they go back for the booster, and then it takes X number of days to have immunity. What was that number?
An additional 7 days
7 days, okay.
before you start to see those titers come up to a level where there's some clinical immunity.
Thank you. Thank you, Chair.
And so far, they've shown 94% effective. Both vaccines were between 94 and 95% effective once the titers had started to build. So,
Good, thank you.
Counselor Shambaugh.
Good morning, Dr. Jones. Councilman Deere has texted me with a couple of questions. Apparently his sound's not real good. The first one is, with the snow coming, are we doing anything different with our drive-through COVID testing? And are there altered hours because of the snow? Is there any winter gear available for the employees, or additional staff to rotate? Has anything changed with that?
so yes, we are continuing to do testing. And yes, there has been, we have bought coats for everyone. We have identified and tried to get buildings with heat out at every location. Of course, all of our testing is dependent on weather. We have put that out that if the weather is too bad, that we will, we'll suspend testing until we can get our employees out safely. So those are some of the concerns that we have looked at and addressed, and currently our testing hours are from 8 to 4. We were doing 8 till noon, and right before the holidays, we extended that to 8 to 4. So, and then on the weekends, of course, we have testing available in front of the Hastings Hospital from 8 to noon, and that's to try to alleviate some of the stress on our urgent care and ER where people are coming in just to be tested, so we can shuffle those out and let those providers in the urgent care and ER have the freedom to treat the patients that really need them and not just be administering tests. So, and that's been very successful. We've been testing quite a few patients in the mornings and there on Saturday and Sunday. So currently we're 7 days a week doing testing, and we're trying to do everything we can to accommodate our employees and try to keep them as comfortable as possible. But as you know, with the weather, it's not something that's very predictable, and we're doing everything we can to ensure that they're safe and that they have all the equipment they need.
Okay, thank you. I have one, he has one more question. This is not related to COVID, but how is HR doing hiring more health workers? Has there been more health workers hired?
Well, I can't speak to that specifically. I don't know the time frames are always, we're always working through time frames, and we're a big department, so we do our best to get our information back to them as quickly as possible so that they can do their job. I do know that they've been hit with some challenges with some exposure and some employees that got some. I know they're a little short-handed right now, but for the most part, we meet with them every once in a while, at least once a month, sometimes every other week, just to go over where we're at in a lot of the hiring processes and trying to get people on as quickly as possible. But it is challenging. It's a challenging environment. There's a lot of competition out for the positions, especially nurses right now, and we're trying to work through those and be as adaptive as we can to ensure our positions are filled as quickly as possible. So it's just a challenging environment for everyone right now.
Well, how short are we? Just ballpark.
Well, we track our we track our employees, and we track how many people are out sick and how many people are vacancies. And our vacancy and sick rate right now among our employees is running around 9%. So it runs a little higher at some clinics at different times and runs a little lower at some clinics at different times. But on average, we're anywhere between 7 and 10%. And lately, after the Thanksgiving holiday, we were up a little bit above 10% at some of our clinics, and so it is a challenge right now and that's what I was alluding to earlier. We have a lot of people doing a lot of extra work and picking up the slack when we have people out. So it's a challenging environment right now.
Well, Dr. Jones, I'd just like to say thank you for everything that you guys have done. I mean, having to deal with something that we've never had to deal before in a new facility, and the number of people. I know it's been, you've had to make some changes. You've had to adapt your the way you do things, and I see people going through that COVID center testing all the time, just all hours of the day. So you guys have done a really good job of trying to keep our citizens safe. And I do have one. Yes, sir. And I do have one question for Chief of Staff. I have received phone calls too from people wanting to know if they get speakers, elders, when they were going to be able to get the vaccine. But I've also had people say, I don't trust it. I'm not going to take it. But this, it's just kind of one or the other. It's not really, they don't really, they have an opinion. So if there's people, say, employed by the Cherokee Nation that don't want to take it, are those people, will there be any ramifications for not taking it if they get sick, if they're offered it? You know what I mean?
Yeah, those are some of the things we've been under discussion for several weeks now, and Dr. Jones shared some information coming out of Europe that are causing us to really evaluate how we respond to that. So one of the things we are considering is we're granting administrative leave for those that may have underlying health conditions and not able to perform their work at home or virtually. And then if employees are contacted and found positive or placed into quarantine for expected exposure, we've placed them on administrative leave. There have been some very rare instances where employees openly violated the executive order, took their mask off, became infected, and we have not paid them administrative leave because they did not follow the rules. So we are looking at the possibility of removing administrative leave. So if they refuse to take the vaccine, if they get exposed and they have to go into quarantine or become positive, we are looking at the possibility that they would have to take their own leave rather than being granted administrative leave. So we, obviously by granting administrative leave, we want everybody to be safe and stay at home when they are found to be either positive or need to be in quarantine. But with the advent of the vaccine and the change that has, if our employees refuse to do it, we may remove the availability of administrative leave. But there's a couple other factors in that, so we haven't made a final decision yet. But it's one of the things that we are considering, and then we're also looking at possible incentives to try and encourage people in other ways as well.
Well, if you do decide to do that, would you let us know as a council so we'd be able to? Now, your mask mandate, and you say if they're not wearing a mask, they get it. Does that include only on Cherokee Nation during Cherokee Nation business or Cherokee Nation property, or does that mean everywhere?
Not everywhere.
Employees.
Yeah,
So we're just talking about Cherokee Nation property, basically?
primarily.
Okay.
Unless, and we had one instance where a bunch of employees got together, had a party after hours, collectively as a group, and then didn't wear masks. And so in that particular case, we did not honor administrative leave in that situation.
Or in maybe the if your duty's called that you go out in public and you are representing Cherokee Nation, you do wear a mask in the public then?
Correct.
Okay, all right, thanks, sir.
And then if I might real quick too, I do want to brief you on human resources, since it was discussed. We have suspended operations inside the human resources main building this morning. We had a high number of positive cases in that facility and had another one today. We went back in and tested over the weekend and sanitized that space as well. But to the question as far as trying to keep health staff coming in the door, we still continued orientation in another building today. And so we've introduced new employees into the health department. We do 2 shifts, so to keep head count down, where we'd normally bring everybody in one lump sum. Now we're breaking those into 2 shifts, Monday, Tuesday, and Wednesday of each week. So it is causing an operational challenge. I did warn many of the executive directors that they should be prepared in this week and coming weeks, several weeks ago, that they should expect to see a decline in employee attendance from anywhere from 30 to 50% of the existing staff may be out of the office either due to positivity or quarantine. So it is going to cause some interruption and delay in services in the coming weeks as we migrate through this virus.
All right, thank you, sir.
Thank you.
Okay, we've got about 12 minutes left. Counselor Buzzard?
Yes, thank you, Dr. Jones. I think you and the Chief of Staff and whoever's involved with these decisions have made some really good choices. I'm happy with them. I just listened to the Chief of Staff talk about whether it's going to be mandatory to take them. I don't think we can do that, and I think he more or less said that. But there's some things that he's talking about. I like those ideas, where you take away the administrative work. I think that's in the right direction. I think most of my questions have been answered, except I do have one. The vaccines that we're getting and administering now, are those strictly for Cherokees?
Well, I can answer that question. They're for our healthcare providers that are on the front line.
Yes.
So that's, yes, there's a percentage of those that are Cherokee, there's a percentage of those that are other tribes, and there's a percentage of those that are not. And so anybody that's caring for our citizens on the front line it meets that qualification, and those are the folks that we're going to be vaccinating first.
Yeah, and I understand that. And that was kind of a silly question to ask, but I'm wondering about some of our native speakers, spouses, and those people like that. That's where my question was leading to. Because they're living in the same household. And that was where my question was, not really the frontline workers, because, yeah, we do need to do those regardless, but that was where my question was leading about spouses of Native American speakers. Have we made a decision on that at all?
At this time, we have not got to that point yet but we don't know what our allocations are. We were working off what we know, not what we potentially might get. And so we're working we're trying to work through, getting through those things that we absolutely know. And what we know right now is we have enough allocation to possibly do all of our frontline and first responders. And we're going to, extend that out and again to those in the elder care, and then we'll be identifying other people that are critical to healthcare needs and then moving to Tier B. So it's a very fluid situation currently, and we haven't gotten to the point where we're going to expand any of those categories yet. Those categories are based on recommendations from CDC, and some of those that we've identified are targeted. But we have not gotten to how far that will go into each category until we know what our allocation is. Obviously, if we had enough vaccine, yes, we would want to do the speaker in the household or the employee in all their households. You can make that same argument. How about the provider and all the household of that provider? And so, but we're not there yet. We don't have the allocation or near the volume that we need to get there.
Okay. The other question I've got is, I've noticed on the press release, it only mentioned W.W. Hastings Hospital. Are you going to be transporting any of this to our outlying clinics? I know you're probably not set up to do that yet, but I suppose that's in the pipeline whenever.
Yeah, I can answer that real quickly, and the answer is no. We are doing it strictly here at CNOC right now. That's where we have the facility set up. That's where the freezer is. That's where the vaccine is. And as I said earlier, it's a very, very tight timeline from the time that we take that medication out of the freezer. And we can only access that freezer twice a day. And we can take that out. We start the process of bringing it down to room temperature and diluting it. And it takes 2 hours to get one vial from, each vial from ultra cold to room temperature and prepared to be drawn up in a syringe to be administered. So, and then you only have 6 hours to work with it. So, it's just too risky to try to do that and transport it and have something happen in the transportation process. It's easier for us to bring our employees here and vaccinate them, where we can watch and we have everything set up to do to watch them and observe them after they have the vaccine, and then release them to go back to work. So, and in the future, we hope when the allocation is better and we have more of it and we have more storage ability out of the clinics, then yes, we will take this process, duplicate it, and put it in different locations strategically across our 14 counties. But again, until we get that next step, that next allocation, or that next vaccine, and we know exactly how we're going to have to work with it and exactly what it's going to take to get from point A to point B and get it into the arm of someone, it's hard for us to make those predictions on what we're going to be able to do. Ideally, we would love to be able to go out to each and every facility and have this available, and at some point we hope to, depending on what the specifications are and what we have to do for each vaccine as we move through getting more and more on the market.
Yes, and I know you guys are under a lot of pressure and stress to get this taken care of, but I could see this, if you're not administering to our clinics, they're going to have a line that's probably 2 miles long coming to Hastings Hospital, so I'm sure you are aware of that. Is there plans to get storage at our outlying clinics?
Yes, and the answer is not. We're not to a point where the vaccine is readily available where we would open it up and say, just come and get in line and get the vaccine. Currently, everything is done on an appointment basis, and we had to do it that way in order to have the follow-up to know when exactly you get your second dose. And as I said earlier, with Pfizer, it's 21 days. With Moderna, what we know now is 28 days. So once we give you the vaccine, we have to know and have to be able to give you your follow-up based on the requirements of that vaccine. So and know which one you got. So it has to be reported, and you have to have that observation time after each dose. So it's not like the flu clinic where we can set up and just have people coming through and we're giving flu shots and we're recording it that you got a flu shot and away you go. This is so technical, and there's so many things that have to go along with it because of the way it's being distributed and the reporting that goes along with it. It's not as simple as saying it's open and just come get in line and we'll get you taken care of. We've got to do it judiciously, and we've got to do it so that we have enough to get through as we start making those appointments. Like I said, we have plans on how we move into the next tier, but we're not ready to roll those out yet, because I don't want to start that down that road until we have the allocation to be able to do it.
Okay. Well, I know you've got a lot of work ahead of you, and appreciate everything you guys have done to set this up. But it's going to be if we don't get it out to the clinics, Tahlequah is going to be overrun by Cherokees. So, good luck. we can support you in any way, just don't hesitate to call the council. Thank you.
Counselor Dobbins.
Yes, Dr. Jones, this next tier, I guess, will be represented by the 65 and older. Keep saying we're going to get the word out. How are we notifying patients when their vaccine's ready? Come in and how are we getting the word out?
Well, so we're not ready to do that yet, but when we do that, we'll be doing it through our communications department. We'll be doing it through, having the ability for patients to call us, to give us, having automation and having schedulers prepared to take that information. But we're just not quite ready to roll out our plans for that yet, so we don't want to create those calls as of yet. So that's our next tier when we get to that 65 and older, and we're going to simplify it as simple as we can and make it as easy as we can on the patient. But we do have to have some patient has to take some responsibility, and we have to have some engagement by the patients. There's no way that we can identify every single patient over the age of 65 and call them and make them their appointment. Some of this is going to fall on the patients to contact us if they want the vaccine, because they have to make that choice on whether they want it or they don't. And we're going to give them every available access we can to get it once we have it in our hands and are able to do that. So we'll be communicating that out through our social media or through our communication department, and they'll be determining what's best to and how to communicate that out, whether it be through social media, our website, news releases. I'm sure there'll be a very wide variety of ways that gets communicated out.
I just ask that we not depend too much on social media. I have a lot of constituents that don't even have internet access. So that's why I asked the question, how we get the word out. One final question. You know, Dr. Jones, in the private sector, has this vaccine been priced? If we have a Cherokee that says, I don't want to wait any longer, I want to do this or that, has that been priced, or do you know, are aware of the market for that?
I don't know that it's been priced, and as a matter of fact, I do know that. I think what I heard on the news that it's the vaccine will be offered free to every American. Now I will say this: I don't know of anybody else that has a vaccine. We offered to be a hub for the state to hold their vaccine and help distribute it out to the local hospitals so that the private sector would have availability to it. They have not engaged us or contracted with us to be that hub. So I don't know, I personally do not know of anyone else in our area that has received the vaccine other than us at this current time.
Thank you, Dr. Jones. Thank you.
Madam Chair, if I-
Counselor Austin.
Yes, Dr. Jones, I heard you say that right now we have something like 1,900 active cases today, currently in the system. That's a daunting number. And I virtually applaud your organization for what they've done, what they're doing, and this monumental task. It's a historic task you're taking on today. The generation of folks who primarily are in this room have never experienced the monumental task you're doing today, and it changes the world. My life was changed because of vaccines that were developed before I was born. With polio, my dad's generation was ravaged by polio. The generation of people before us if you had 4 children, one of them would not make it to adulthood because of a common disease that today we have a vaccine for. We are so grateful to be living in a time when modern science is able to find a way out of this thing that we call COVID-19. We applaud you, we applaud your team, we applaud every single healthcare worker for showing up. It has been hazard duty all year long, and they truly deserve our appreciation. Thank you.
Thank you very much. I'll pass that along because right now all those accolades and every thank you means a lot. And we try to I encourage all the administrators and myself included when we have a chance, we walk down and thank those people, because it's there's a lot of folks out there that are meeting COVID face to face every day. And they're treating those patients on the front line. They're testing them out in our testing lines, and those positive thank yous mean a lot to those folks. They really are working hard and going above and beyond in every way.
Just two things, if I could, real quickly clarify. So, Counselor Buzzard, your questions about are we going to roll it out to the clinics? Absolutely. First off, I thought Cherokees did rule Tahlequah, but if there's a few more that tips it in our favor, I'd be happy to bring them into Tahlequah. But so yes, it is definitely our plan to make sure that those vaccines do get out to the clinics, that we do get as much out to citizens and bring it to them rather than them coming to us. And then the other thing I would like to do is there's a gentleman on this call that hasn't spoken up yet, and that's Dr. Montgomery. In addition to Dr. Jones and Dr. Montgomery, and there's several other people, we meet on a daily basis. We meet on weekends. We have phone conversations. I task them with off-the-wall questions on a Saturday night or a Sunday morning, and they continue to stand for the call. And so I would, in addition to the accolades that you guys have provided directly to Dr. Jones, I was going to send Dr. Montgomery a text message earlier today just to tell him thank you, but I want to make sure I do it publicly here because he is a quiet but well-spoken advocate, not only for sound health, but for each of our citizens, and I would like to recognize him as well. Well done.
Thank you for that, Chief of Staff Enlow. Counselor Shambaugh.
All right, Dr. Jones, this is going to be very quick. I really don't need a long answer. Really, it'll probably be a yes or no. I think it's very important that our leadership is protected too. Do you consider yourself and your staff and our chief and his staff as frontline? And will they receive the vaccine?
Well, that's a good question. I think in this front line, this first round, then the answer is no. We're not facing COVID face to face every day. Those people that are facing it face to face and are high risk for exposure are our first tier. We meet somewhere down there in phase 2. So, but we may be essential for our health services, but we're not critical. We're not the critical people that are out there caring for our patients every day. So I can speak for our team, and when we all feel that way. There are a lot of people that are far in front of the line for us, and again, it's all based on allocation, and when we get to that level, we'll be glad to step up and take the vaccine. We've all talked about it and whether or not we would take it if it was offered to us, and yes, my whole team is ready to step up and take the vaccine when it's our turn, but it's not our turn right now. It is those people that are meeting the disease face to face, and we want to step out of the way and let them have the opportunity first to get the vaccine if they so choose. And with that, I do want to, there's a lot of people that I can thank on our team, and Dr. Montgomery, Mr. Hale, Mr. Caldwell, Lisa Tivick, you can go, Becky Shepherd, I can go on for a long time on a lot of the people that are on our team that meet every day and work on these problems, try to come up with ways and answers that our frontline people bring to us, and try to remove obstacles to allow them to care and do the critical care that they have to do every day to take care and meet our citizens where they need us to meet them. So the list goes on, long list, and at some point in time, when we have more time, I'll give you a comprehensive list of all the people that were critical to this whole process. But right now, we've got to focus on those that are on the front line and make sure that they have all their needs met, and that's what we do each day.
I appreciate that, Doctor. That's very admirable, but I'll leave you with one thing, but it's also very important to protect our leadership and the people who make decisions too, because if something would happen to you or somebody, or Dr. Montgomery, then somebody else would have to step up in your place and do the same thing. That's the way with our chief. If something happened to our chief, if our deputy chief, and I know there's just a few left, but we really need to protect. Let's put the brains behind the outfit too. So just don't forget that, and don't sell yourself short. Your decision making is very, very important to the whole nation as a whole. So, thank you, sir.
Appreciate it.
Yes, we as, first of all, George Value's not going to report. They're having issues there at their hospital, and I just got the message there.
Thank you.
Second, I'd just like to commend the chief and the health officials. You mentioned Dr. Montgomery, Dr. Jones, Pivick, Dr. Nolan. We're very fortunate and blessed to be able to administer. Like you said, there's close to 573 tribes out there, and here we are. We've already got the vaccination here. A lot of tribes are not going to be able to do that. So, with the experience that we have, Chief of Staff, the way you've administered this, I really appreciate that. I mean, we've really done well, under the circumstances and taking care of our people. I was looking at the different tiers here, our first responders, and we talked about the speakers and elderly care. It was mentioned earlier that the speakers some of them are hesitant. In a funny way, the elderly speakers I spoke to, 75 and over, they said, "Can we get non-Cherokees to take the shot first and let us watch?" And that's what they said. I said, well, I don't know. But having said that, they are willing to take it under the circumstances. If it is taught to them in the right way how this thing works. And I hope our speakers out there, we talk about Howard, Roy Boney and those people, if they will present it in the right way. They're willing to take it, because our last count, I think we had like 2,400 speakers out there. And maybe we'll get 80%, 90%. That's a high number. So I just want to commend you on how we're handling this and how blessed we are. 6 months ago, we were still scratching our heads trying to figure out how we were going to get through this, and we're not through it yet. And we've had a lot of our own people here affected. It's really good to have Councilmember E.O. Smith back with us today. It really is to look at him. You never know. And we've got another person that's out. We just keep him in prayer. But, we're going to get through this. But with your leadership, Chief Hoskins and Deputy Warner and Dr. Jones and Chief of Staff, we're really doing a good job. So, we're going to get through this. I just wanted to tell you how blessed we are to be where we are. Thank you, Dr. Jones. Thank you, Madam Chair.
Thank you.
Okay, Dr. Jones, was the freezer timer set by us, or was that a prerequisite of acquiring the freezer?
Was the I didn't hear the
The
first part of
timer
that.
on the
Sorry.
freezer, because I know I'm going to be asked this, was the timer on that freezer set by us to where it only opens every 6 hours?
No, that's the requirements of the vaccine. You can only tap into. We can open the freezer every time. It's not locked. You can open it as many times as you want, but the requirements, the specifics of the vaccine and the way it's stored, you're only supposed to access that freezer. But once you open the door, the temperature starts to drop 2 times, maximum of 2 times per day, in order to keep the vitality of the vaccine intact.
Okay, and when can we expect more vaccine to come in?
Well, we do know that we will get a second allocation of approximately 25% of our first allocation in the next 7 to 10 days. Now we will be getting our second doses. This dosage that we're getting now is not part of our second doses. For every initial dose that we give, we are going to get the second dose to be given at 21 days. So we will be getting a smaller allocation in 7 to 10 days, approximately 25% of our first allocation. And then there's a possibility that we'll be getting more after that. A lot of the allocations moving forward are going to be based on our ability to be efficient and not waste any and get it into the arms of our participants. So the allocations are based on usage, so we don't know exactly how much we'll be getting, and they'll let us know as things move forward. There are a lot of, as was said earlier, there are a lot of tribes that are not participating in this at this point in time because they don't either have the ability or they don't have the freezers. There's a lot of things that have come into play that are excluding them from participating. So I have to say our team has done a great job in anticipating those challenges and getting them put to bed before they became critical challenges. So right now, we feel like our allocation will increase because we will be able to work efficiently and get the ones that we've been allocated so far in use. If you have it sitting on the shelf and you're not using it, they're not going to give you more. So it's all based on how fast and how good we do at getting it put into the public.
Thank you. Will children be vaccinated eventually?
I'm going to leave that one up to Dr. Montgomery to answer. He's been studying the EUA a lot more than I have. So, Dr. Montgomery?
At this time, again, the initial EUA was based on a group of study population of 16 and older, so we don't have an answer yet. But yes, I think we will eventually have those kinds of recommendations, but it's going to be several months down the road.
Several months down the road. Dr. Montgomery, are 16-year-olds going to be allowed to be vaccinated?
It is approved for use. The EUA includes medication for 16 and older.
16 and older. Thank you so much. Listen, on behalf of the Health Committee here, we want to thank all of you and all the health workers, first line of defense workers, and everybody who is working to make this campaign successful. And please let everybody know during this special holiday season that's unlike any of us have ever experienced, how truly grateful we are for our healthcare workers. Thank you so much. Would you all join me in a round of applause? Thank you all so much. And with that being said, then we will go on to our next reports. Again, thank you all again. We appreciate you. Okay, next up we have the PACE. Is Thelma Pittman with us? The PACE report.
This is Connie Davis. I'm with you.
Oh, hi, Connie. Connie, what would you like to share about your report today?
Well, I assume everyone has a copy of the report, and I don't feel the need to duplicate anything in there. I'm sure the question most of you guys want to ask is if we've had any participants with COVID, and the answer is yes. We've had 9 out of roughly our census varies between 180 to 187, and we've had 2 deaths. Now, both of those deaths were COVID that was acquired, one in a nursing home and one during a hospitalization. And I think we've had 10 employees with COVID and no deaths. The ADHD is still closed, obviously, until the vaccine's administered and the governor basically opens us up back up, but we don't expect that to be anywhere in the near future.
Thank you. Anyone have any questions for Connie? Anyone?
Hey, Councilor Shaw.
Yes, Councilor Deere.
I just want to tell Connie thank you for the last month and her assistance. So I appreciate that help.
Happy to help, Counselor.
Anybody else have any questions? No? Well, Connie, please, wish everyone at PACE a happy, joyous holiday season for us, will you please?
Of course, and the same to each of you as well.
Okay, thank you so much. Next up, we have Cherokee Nation Home Health and Cherokee Nation Hospice. Is April Moore on the line?
This is Kristen Crawford. I'm the Director of Operations, so I'm going to do this today.
Hi, Kristen.
How are you?
Very well. Fire away.
All right. So you guys got a copy of the report. I'm just going to kind of skip down to the COVID details. You guys can see the census numbers. As of November 30th, we've taken care of 17 patients that had tested positive for COVID. They were actively infected at the time that we cared for them. We've had 2 patient deaths related to COVID-19 since the pandemic started. We've had 7 employees test positive for COVID. They're all fine. They're all back at work. They're healthy now. CNHHS has partnered with Cherokee Nation Health Services to be able to perform the COVID rapid testing on our own employees. So as a result of that, we were actually able to offer voluntary testing to our employees after the Thanksgiving holiday, just to ensure that none of our employees were positive and going out and seeing patients and putting citizens at risk. Our employees continue to show a great deal of courage during this pandemic. They're in patient homes every day. Sometimes they walk in and they don't know, that maybe there is somebody positive in the home, but they continue to do it every day anyway. So we're very thankful for that. And then we're also very thankful for Cherokee Nation administration and the council's support throughout this time.
Thank you, Kristen. Does anyone have any questions for Kristen at this time? Kristen, again, please wish everybody at Cherokee Nation Home Health and Hospice a happy holiday season for us, and thank you for the report.
Yes, thank you guys.
Any old business? Any new business? Announcements, our next meeting is January the 11th at 1 p.m. next year. Anybody want to make a motion to adjourn?
So moved.
Second?
Second.
Okay, all in favor? Aye.